Today's Lauren talk is coming from the bathroom. So, couple of things that can help with going to the restroom. One, trying to go to the restroom within 30 minutes of eating. When we eat, we naturally increase what's called peristalsis. That's the muscles of the flow of the intestines, the bowels, to push food through the intestines into the rectum so that we can go to the restroom. So if you are constipated or you struggle just a little bit, preparing like 30 minutes after eating a time where you can go to the bathroom and you can relax for a minute can help increase that probability of having a bowel movement. You can also drink warm liquids, whether that's coffee or just lemon water, to have a bowel movement. The next best thing is, my friend, the squatty potty. So we have a muscle in the back that loops around the rectum, which is where bowel poop comes out. And when we are in the squat position, that muscle becomes the most relaxed. So we can actually give the rectum more space to fill and to relax, to expel the bowel movement when we are in the squat position. So not only the squat position, but equally what our hips are doing. So we want to be typically nice and relaxed. If you have a tight pelvic floor, you may notice you might go out like this. That actually tightens that posterior pelvic floor and can make a bowel movement a little bit harder. Equally, when we bring our knees in, it opens that posterior pelvic floor, creating a little bit of lengthening to allow the bowel movement to flow more freely. So even with the benefit of a squatty potty, you might want to just try and experiment. Do you do better with knees wide? Do you do better with them close together? If you're hypermobile, some people need to apply pressure onto the outside in order to provide just a little bit more support in the lower abs and hips and pelvis so that they can have a bowel movement. So squatty potties are your friend. They help elevate it, help relax the posterior aspect so that you can poop, play with your knee position, and then just eat and try and use the restroom 30 minutes after you go into eating.